So, welcome back to Virtual Health Careers Live 2021. So, up next is Dr. Shamir Mehta, who is a general dental practitioner. He'll be discussing leadership in dentistry, giving some examples along the way, and also introducing the General Dental Council. So, Dr. Mehta, are you there?
Yes.
Fantastic. How are you doing this morning?
Yeah, very well, thank you.
Fantastic. Right. The stage is officially yours.
Brilliant. Thank you very much. Hi, my name is Shamir. I'm going to speak to you about leadership in dentistry. I'm the Senior Clinical Advisor to the General Dental Council. So the presentation is a fairly short one. I'm going to cover something about what the GDC does, what it's about, the importance of effective leadership in dentistry, and the sort of requirements for good leadership, illustrated with some examples. So just about the General Dental Council, we're the regulator for the dental profession across the UK, and we have about 115,000 registrants. We basically have the full dental profession as part of our register: nurses, dentists, hygienists, technicians, etc., etc. And we're one of the 9 UK regulators, and you may have heard of others such as the General Medical Council, etc. And our remit extends, to include NHS and private practitioners. And we work alongside other regulators as well, such as the Care Quality Commission. The GDC has 3 primary functions. Firstly, to protect the health, safety and well-being of the public, so any concerns they may have, to maintain public confidence in the dental profession, and lastly, to promote and maintain professional standards and conduct of dental professions. So I know this is a bit of a whistle-stop sort of presentation, but my focus today really is on leadership in dentistry and visible leadership. And I guess the first question to ask is, well, what's it all about? Why is it so important? And really the purpose of good leadership is for the delivery of high quality care within organizations and the wider healthcare system. And I think central to this is the patient. And sometimes that can be sort of put aside, but central to everything is good patient care. Now, there's sort of 3 main types of leadership roles in dentistry. One is leading the dental team, ensuring appropriate patient safety. And I'll give you sort of examples of this. The other is leading patients to improve their own oral health. And finally, leading the wider community and healthcare systems. So what does it take to sort of present good leadership in dentistry? What sort of skills are required? Well, I think there's sort of 5 key areas, if you like. One is having problem-solving skills. Now, within dentistry, there are a large number of roles, and we can broadly classify these as clinical and non-clinical. But regardless, one of the things that is absolutely pivotal to good leadership is having good communication skills. And that might be sort of verbal, written, etc., etc. One other thing which is important is having appropriate emotional intelligence, connecting with people, and that's particularly important at the sort of practice-based level where you're looking at things like conflict resolution and how to manage concerns, complaints, etc. in an effective way. Another sort of requirement is the ability to motivate your team towards a common aim, and that's very important. To ensure that you're all heading in the right direction. And at times energy can sort of flag, and it's just having that skill to keep the momentum going. You've also got to have the ability to trust members of your team and let them take ownership of their own tasks. And again, the same applies in the clinical sphere and in the non-clinical, striving towards that common goal. And finally, one thing which I certainly think is very important is encouraging learning and development within your team, and that helps the team grow and go from strength to strength. Now, a lot of you may sort of think, well, I'm not sure if I have these skills or whatever. And some of you may be involved with leadership roles within what you might be doing. But I can tell you that when I was younger in school or whatever, I didn't have any sort of opportunities. But I think I knew that I had it within me to do these sort of things. And, these skills can be learned and improved in different ways. There are lots of courses out there, and mentoring is something that's gathering a lot of momentum, where, there's a lot of people out there who are willing to help, to help sort of nurture and develop somebody to become a good leader, which is very important. Some examples of leadership in dentistry, and some of these are sort of, areas where people can get involved as well. I guess that the most frequent one is clinical team leadership, and that may well be in a practice level as a practice principal or clinical director or registered manager or clinical lead, to ensure that the practice runs in a smooth way, patient care is delivered in a good quality, safe manner. Or that leadership may well be in a trust where someone may be head of a department or a group, etc. There's also wider community-based leadership, where certain individuals or groups may be engaging with schools, care homes, GP practices, working with sort of multi-professional groups with the aim of improving oral health at a local level. And again, a lot of colleagues get involved with that kind of thing. Then you have the local dental networks, what we call the LDNs, who again work in sort of a multi-professional format, who give advice to commissioners, where they're basically looking at things at a local level to improve services, leading to an improvement in oral health. So that's another key sort of example. And then there are sort of things where dentists can be involved, or dental professionals can be involved. One is joining a local dental committee. These are sort of committees that take place at local level, where dentists are elected to these roles, and they represent the concerns of the local dental community to whoever it may well be. And that's again very important, and a lot of people get involved with these sort of things, where there are things taking place at local level, where sort of more sort of people at higher tiers may not be aware, and that's very important. And then you've got associations like the BDA, the British Dental Association, where again people can be elected to that, which is almost like the union body for dentistry, and that has a very important role, especially at the current time with the pandemic, and sort of leading the way in terms of practicing in the way things take place as well. And there are also various national associations, one which is a newly formed one, which is the College of General Dentistry, which sort of predecessor was the Faculty of General Dental Practitioners, which again is a voice there, or for nurses, the British Association of Dental Nurses. And these are sort of organizations where people who want to get involved, can all sort of join. They're very welcoming, and there's that opportunity to sort of really dig in and do your bit. But there are lots of examples of leadership in dentistry, ranging from the chief dental officer, if you like, all the way down to sort of daily leadership within the practice team. Now, as I said, there are lots of examples of leaders, and it would take me a whole day to go through them. And I guess it probably wouldn't be right, because I don't know those individuals that very well. So what I can talk about is my own experience of leadership within dentistry. So I'm a partner in 2 dental practices in Northwest London. We've got a team of about 20 people, 20 members of staff, and a fairly large patient base. And my role is, the managing the practices, managing the staff, ensuring effective, good quality, safe patient care, etc. So, that's something that takes place on a daily basis. I'm also the senior clinical advisor to the General Dental Council, where I lead the clinical advisory team at the fitness to practice level, where, my role is to ensure that where there are clinical complaints, that my team provides consistent, good quality, effective advice to help manage, these complaints and concerns. I also have an academic role at King's College London with an MSc in Aesthetic Dentistry, where again it's leading the program, and it's a very popular postgraduate program, and dealing with students and managing other teachers are involved. I also have a role as a researcher, and some of my research work is used to sort of inform the wider profession at the international level, and it has formed part of various guidance documents. So again, that's another way where you're not directly dealing with individuals, but what you do is important to the wider profession. I used to be a member of a local dental committee for Harrow, again representing my sort of input, giving my input at local level. And then I've got a role with Health Education England at the Centre for Advancing Practice, which isn't explicitly linked to dentistry. So, you get individuals who would be doing any sorts of these sort of things, and they can be routine general dental practitioners, such as myself. So, there are a lot of opportunities to be involved with leadership in dentistry, doing all sorts of things, clinical and non-clinical. And for those of you who might be interested, there are multiple avenues, and there are people out there who would be willing to help, guide, etc., etc. So, lots of opportunities out there for you. Now that brings me to the end of my presentation. I don't know if we've got the opportunity for any QA or anything like that, but I'll hand over back to the presenters.
Wow, thank you so much for taking the time to be with us here this morning, Dr. Mehta. Lots of key messages that I'm sure we've all taken away from today. I've got one kind of question that I've had come up through some of our attendees privately, and it's if you could tell yourself, kind of your younger self as a dental student, one thing about kind of developing your leadership skills, what would it be?
That's a very good question. I think it is to get involved. There are lots of opportunities to be involved. I mean, I was a dental student a long time ago, but there are lots of, certainly where I teach at King's, there's lots of societies doing all sorts of things. Some of them may be sort of social, some of them may be more sort of clinical, and there's a lot of opportunity to be involved, and that comes with a lot of networking opportunity as well. And I think we all kind of know that one of the things that's very important is who you know and the networks you can belong to. So as a student, the sort of advice I would give is where there are opportunities to be involved of something that sort of takes your fancy, give it a go.
Wow, thank you very much. So I think that's enough from us for a little while. Thank you so much for being here with us this morning, and I hope you enjoy the rest of your day, okay? See you guys in 5.